Okay guys, we are going to discuss heart conduction. Want to know how this heart is able to contract and relax. So the heart, and again something that will help us to understand, we should know what type of muscle is the heart. Is it skeletal? Is it involuntary or voluntary muscle? So once we know that, then we are going to identify how this type of a muscle works. So in this case, I'm giving you 1 minute just to identify what type of muscle of the heart is. Okay, thank you very much for your answers. So I'd like you guys to pay attention as we are taking a discuss on this topic, heart conduction. So first of all, we should understand what heart conduction means. Heart conduction system. There is conduction, there is heart, and there is also what? There is system. So let's talk about what conduction is. So if you remember, we can relate this term to physics science, physics, the one we learned in grade 12. Conduction, just the transmission of heat from one place to another. But for this one, since it's the heart, you can say conduction is the transmission of impulses from its origin place to the ending point. Then there is the heart. Heart, just an organ that pumps blood to all parts of the body. Then we have system. So the system is more like a structure which gives order for other things to operate. So a system is more like a structure. They work together for a common goal. That's a system. So now we want to know how the heart contracts and how is it relaxed and what happens. So since we identified that the heart is an involuntary muscle, of which involuntary muscle, these muscles, they work with no control by the external mechanisms. For example, if I say this is voluntary muscle, like the skeletal muscles, those muscles, they work under control of the stimuli. If I want to sit, it's me making muscles to relax or to contract. If I want to take a walk, it means these muscles, it's me to tell them that I want to walk. Then, but for the heart, no one will tell the heart to stop pumping. No one will tell the heart to relax, or no one to tell the heart to contract. So that's our interest in this topic. We want to know what makes the heart contract. So the heart contracts without any external mechanism, but is based on parasympathetic and sympathetic nerve fibers, which controls the contraction and relaxation of the heart until blood is pumped into the general circulation, then others to the lungs for oxygenation, then can be used. So I'm using a phone, so maybe it may be difficult for some of you to visualize the diagram, but I'll try. Okay. So this is the heart. So the heart has an intrinsic system whereby the cardiac muscle is automatically stimulated to contract without need of external stimulation, like what I said. So the heart has an intrinsic system where the cardiac muscle is automatically stimulated. No need of any external stimuli to stimulate the heart so that it starts what? Contracting or relaxation. But it's on the heart and this intrinsic system to make it contract and relax. So this property is called autorhythmicity because it's itself the heart and the parasympathetic, also the sympathetic nerve fibers that stimulate the contractions and relaxations of the heart. So I hope by this stage every one of you at least knows how to draw the heart. So it's very important to know the circulatory system of the heart and the conduction system of the heart. Like in this case, the circulatory system of the heart is different from conduction system of the heart. So the most important components in conducting system of the heart is the SA node, the pacemaker, the atrioventricular node, the bundle of wheels, the bundle branches, Purkinje fibers. These are the most important parts when it comes to label the heart, but the rest you can put it for just for formality, but the most considered points are those I've mentioned. Okay. So now we should know how the SA node, the AV node, bundle of waves, bundle branches, and the Purkinje fibers, how do these points or structures work? How do they contribute to contraction and relaxations of the heart? Remember we said we have three words there: conduction, heart, and system. So there is this conduction which is making this system to work together so that at the end of the day the goal is achieved. And the goal of the heart is to pump blood so that this blood is reached into body tissues and organs. So its main function is to pump blood to all parts of the body. Okay, so let's talk about the SA node. The SA node. How is this SA node works? So the SA node, when writing, let's look at the SA node. Let's look at the SA node. So the SA node there, the other name is primary pacemaker, we just say, or pacemaker. When you say pacemaker, it's one that regulates how the heart should work. So the SA node is also called a pacemaker, and this pacemaker is allocated near the vena cava, specifically in the right atrium. So it's allocated near the vena cava, specifically in the right atrium. And we know this vena cava is one that collects blood from upper parts of the body. So it's there because of the purpose. So when blood is collected, it has to pass through the SA node because the SA node is near the vena cava. So once blood passes there, it will stimulate the SA node to produce the impulses. Have you seen in the diagram there the arrows that have crossed over the aorta till to the what? To the left atrium. And again there are those production of impulses from the SA node to another node, which we'll talk about. So immediately these impulses are produced by the SA node. they will make the contraction of both atria, the right and the left atrium. And assume that in this atria there are blood. So what will happen when this atria contracts? It means the blood which was confined in this atria will be pushed into the ventricles through the atrioventricular valves. Because the atria, they have contracted, making the ventricles to be relaxed so that they are ready to receive blood coming from the atria. So that's how the SA node works. It's just produce the impulses once it is stimulated by blood. Then once the impulses are produced, they cross over to the left atria, and this will cause the atria to contract. And once they contract, it means the ventricles will relax so that blood can be pushed down to the ventricles through the atrioventricular valves. So that's how the SA node works. So when writing the points, we should relate it to the headline. We said heart conduction system. So there must be communication. The structure and the conduction must work together so that at the end of the day the goal is achieved. So we have seen there's conduction, there's transmission of impulses. Then after this transmission of impulses, then these guys say, hey guys, let's contract, let's push these guys down so that we remain free. And yes, they contracted until blood is pushed down. And we are talking about the system. The valves there, they are also part of the system. So when this atria contracts, they will tell the valves to open. Hey, you guys, let's open. We need to push these guys down. Then they will open because they are working together so that they achieve a goal. So once the valves are opened, what will happen? Blood will go into the ventricles. There, when they go into the ventricles, then it means these ventricles, they have relaxed so that they can receive what? Blood. Okay, that's under the SA node. Now let's talk about the AV node. What's their function? Okay, so let's look at the SA node. So there they are saying the SA node, the natural pacemaker of the heart in the SA node, a specialized group of cardiac cells located in the whole of the right atrium, they are the opening of the spiral vena cava. That's what we said. It's a pacemaker which is located in the whole of the right atrium near the spiral vena cava. So the SA node is the pacemaker of the heart because it initiates impulses more rapidly than other groups of neuromuscular cells. So the SA node, once they are stimulated, these impulses will make contraction of the atria, and once the atria contracts, what will happen? Blood will push down to the ventricles. So that's the communication. So let's talk about the AV node. The AV node. So the atrioventricular valve from the SA node, impulses for contraction travel to the AV node, small mass of neuromuscular tissue located in the whole of the atria near the atrioventricular valve. Normally, the AV node conduct impulses that arrive via the atria. The transmission of impulses from the SA node to the AV node and to the rest of the atria myocardia bring about atriosystole. So this one delayed in electrical signal taking about 0.1 of a second to pass through into the ventricle. This allows the atria to finish contracting before the ventricle starts. So that's why it is called a secondary pacemaker. So once these impulses are produced, like as you are seeing the diagram, so once these impulses are produced from the SA node, others go to atrioventricular valve. So this one would delay. So it's like the AV node is one that you initiate the compression of contraction of the atria so that blood is pushed down. That's why it's called a secondary pacemaker. So for these impulses to reach the AV node from the SA node, they talk about the duration of about 0.1 second. So 0.1 second. So once the impulses are produced from the SA node, for these impulses to reach the AV node, there must be a duration of 0.1 second until there is compression of this atria to contract. So the AV node has a secondary pacemaker function and takes over this law of if there is a problem with a SA node. Its intrinsic firing rate, however, is slower than that set by the SA node. So that's how it works. So the way it is in summary for these two components is, once blood enters the atria, so this blood will initiate or stimulate the SA node to produce the impulses. And once these impulses are produced, you have seen the diagram there, others cross over to the other side of the heart, which is the left atria, then others will go down to the atrioventricular valve. So once these impulses are produced, there must be contraction of atria, and assume that there is blood inside there. There is blood inside there. So once this contract, but not complete contraction, what will happen now? So those that will go to the atrioventricular node, which is the AV node, for them to reach the AV node, there must be a duration of 0.1 second. And once they reach there, that's when there will be compression of contraction of the what? The atria, and blood will push down into the ventricles through the what? The opening valves, which are atrioventricular what? Valves. So that's why the AV node is called a secondary pacemaker, because it also works like the SA node. It also initiates the contractions of the atria. So when these upper chambers of the heart contract, it means the lower chambers must be relaxed so that they are ready to receive what? To receive blood contents. So that's how it is. Now let's talk about the band of width. So the band of width, another name we can call is atrioventricular bundle or band of width, and there it has two branches, which is the right bundle branch and the left bundle branch. And there to the bundle branches, there are small branches which are called the Purkinje fibers. Now let's talk about the bundle width. So the bundle width or atrioventricular bundle is a mass of specialized fibers that originate from the AV node, if you have seen there. So have that picture of the heart. As we are explaining, we should have that heart picture so that we know where we are going. So a bundle of width is just a specialized fibers that originate from the AV node. The AV bundle crosses the fibrous ring that separates the atria and ventricles. So that's fibrous ring that separates the atria and the what? The ventricles. Then at the upper end of the ventricular septum, it divides into right and left bundle branches. Within the ventricular myocardium, the branches break up in the fine fibers called the what? The Purkinje fibers. So, the way it is, remember from where we came from. This AV node receives the impulses, then after it receives the impulses, what happens? There was compression of contraction of this atria. So if you have seen there, the AV node is connected to the what? The bundle waves, or the bundle waves connected to the AV node. So it means if this AV node receives the impulses, the bundle waves, the same impulses, will use the bundle waves for them to reach the Purkinje fibers. So it's like the bundle waves will be the mode of these impulses because it's connected to the AV node. So once these impulses are produced, they will pass along the what? The bundle of his, or atrioventricular what? Bundle. So this bundle waves will transmit the impulses along there. Then there are two branches from the bundle waves, which is the left bundle branch and the right bundle branch, which will then transmit the impulses until there is these small branches which are Purkinje fibers. And the Purkinje fibers, when these impulses reach the Purkinje fibers, then the Purkinje fibers will transmit the same impulses into the myocardium mass of the heart. And again, the myocardium mass of the heart is one that responsible for the contraction and relaxation of the heart, because it's more like the big layer of the heart. The big layer of the heart, and again, is thick than other muscles there, or than other layers there. So the Purkinje fibers, once they receive the impulses from the bundle branches, then they will transmit the impulses into the myocardium mass of the heart. And when this is done, what will happen? Have that picture in mind that the blood is in the ventricles. So once this muscle receives the impulses, there will be initiation of what? Contraction. So the ventricles now will contract. So once the ventricles contract, what will happen? It means the atrioventricular valves now will be closed, so that to prevent the backflow of blood. So the atrioventricular valves will be closed. Once they are closed, what valves will open is the aortic valves and the pulmonary valve. So once this ventricles contracts, so the blood which were to the left ventricle will enter the aorta through the aortic valve into the general circulation. Then the blood which were into the right ventricle will enter the what? The pulmonary artery through the pulmonary valve till to the lungs for oxygenation. So that's how the heart conduction works. So the most important thing under this topic is how now you defend yourself, how this heart more like works without any external stimuli. And we have seen there is no application of external stimuli to make the heart contract or relax, but it's the heart itself and the sympathetic and parasympathetic nerve fibers that makes it to contract and relax. So let me go through once again so that at least at the end of the day we understand. So I'll start with The heart, the most important thing to know about this topic is to know what type of muscle is the heart. And when we identify that type of a muscle, how that muscle works, what makes it to perform like that, then at least we have an idea. So now we're saying the heart, for it to contract, there is no need of external stimuli, but it based on parasympathetic and sympathetic nerve fibers for it to contract and relax. Therefore, heart conduction has the following components, which are sinoatrial node, pacemaker, AV node, the atrioventricular node or secondary pacemaker, atrioventricular bundle or bundle waves. We have the bundle branches, which are divided into two, which the right bundle branch and the left bundle branch. We also have Purkinje fibers. Now, let's talk about the SA node. So sinoatrial node is also called pacemaker. This sinoatrial node is located near the spinal vena cava, specifically in the right atrium. And you know the right atrium is one that collects blood from upper parts of the body. So when this blood enters the right atrium, once it passes through the SA node, it will stimulate the production of impulses, of which we have seen in the diagram. Once this is initiated, there will be production of these impulses, which will cross over to the right atrium. And when these impulses are produced, there will be short contraction or minimal contraction or partial contraction of atria, both atria. Then before complete contraction, some impulses will be sent into the SA node. No, I mean the AV node. The AV node is an atrioventricular node or secondary pacemaker. So once this AV node received the impulses for the duration of 0.1 second, this now will complete the contraction of the atria. Since there was partial contraction, but once this received the impulses, there will be complete contraction of both atria. And when this complete contraction of both atria, what will happen to blood? It means now these atrioventricular valves will open so that blood is pushed down to the ventricles. So there will be contraction. So the point on SA node and the AV node, these two, they just make the contraction of atria. So they just initiate contraction of atria. Then after there, you have seen the bundle with the yellow line there on the septum of the heart. The septum is one that divides the heart into two sides or parts. So there is a line there, single line from the AV node to where it is pointed there. So that's the bundle of waves. Now what will happen to this bundle of waves? So the bundle of waves is one that transmits the impulses. It's one that transmits the impulses to both parts of the heart through the bundle branches. So the bundle branch, let's say the right bundle branch will influence the right part of the heart. Then the left bundle branch will also influence the left part of the heart, because it has its own what branches that we have seen there. We have Purkinje fibers to each part of the heart. So there the right bundle branch will transmit the impulses into the right part of the heart until these impulses reaches the what? The Purkinje fibers and are transmitted into the myocardium, which will influence also the right part of the heart. Then the left part of the heart has left bundle branch, which will transmit the impulses into the left what? Purkinje fibers, and they transmit the impulses into the myocardium, which will also influence the left part of the heart. So these impulses, they move at high speed, of which only those that can measure. But for the sake of learning, these impulses, they travel at same rate. So once these Purkinje fibers or the myocardium receives the impulses from the Purkinje fibers, there will be contraction of the ventricles. So what will now help blood not to go into the artery again? The ventricles, the atrioventricular valves will close so that to prevent the backflow of blood. There, when these ventricles contracts, it means the left ventricle blood will enter the aorta through the aortic valve until it enters the general circulation. Then the right part of the heart, which is the right ventricle, when it contracts, it will pump blood into the pulmonary artery till goes to both what lungs, the left and the right lung, for what? For oxygenation. So that's how heart conduction is. So now, since now we have come to know how the heart conduct, this is another diagram. We have SA node, the AV node, the interlateral septum, the left branch, the Purkinje fibers, interventricular septum, right bundle branch. So one of the same. So that's how the heart contract. So now, what to know? The nerve that supply to the heart, the nerve supply to the heart. So the nerve supply to the heart, the heart is influenced by the autonomic what? Nerves, parasympathetic and sympathetic. That originates in the cardiovascular center, in the medulla oblongata. The vagus nerve, parasympathetic, supply mainly the SA and the AV nodes and the atrial muscle. Parasympathetic stimulation reduces the rate at which impulses are produced, decreasing the rate and force of the heartbeat. The sympathetic nerves supply the SA and AV nodes and the myocardia of the atrial and ventricular. So like what we said, if maybe the heart is, for example, if there is secretion of adrenaline, we experience the heart pumps faster. What makes that? So that's why we are saying this nerve supply, it is influenced by autonomic nerves, the sympathetic and the parasympathetic. So now if there is that heartbeat, tachycardia, what will happen now is they work for parasympathetic to reduce the rate at which the impulses are produced, so that to decrease the rate and force of the heartbeat. So if maybe there is tachycardia, to say if there is tachycardia due to production of adrenaline, what will happen? The parasympathetic nerve fiber will come in, will take a role to reduce the heartbeat. Now, what if the heart maybe is you are experiencing the bradycardia, which means there is low heartbeat. The sympathetic also come in place so that to increase, at least to normalize the heartbeat. So that's how the conducting system of the heart is. It's not that difficult to understand. It's not that difficult. The most important thing is to note on that is how the SA node works, the AV node works. And once you understood that, it will easy for you to explain. That's why I started to say first you should identify what type of the muscle is this one. Once you identify, it will make you easy to explain. So now let's talk about factors that affect heart rate. There are factors also that affect heart rate. So like we have autonomic nervous system. So under this one saying the rate at which the heart beats is a balance of sympathetic and parasympathetic activity, and this is the most important factor in determining heart rate. Autonomic nervous system. So it's itself now. It's itself. So the rate at which the heart beats is a balance of sympathetic and parasympathetic activity. And this is the most important factor in determining what heart rate. So this one affects heart rate also. Circulating what chemicals. The hormones adrenaline and noradrenaline secreted by the adrenal medulla have the same effect as sympathetic stimulation, i.e. they increase the heart rate. Remember, if these hormones, the adrenaline, are produced from the adrenal glands, what will happen? It means they will prepare the body to fight or flight. So what will happen now? There will be increase in heart rate. So it has affected the normal heart rate of the heart. It has affected the normal pumping action of the heart. Instead of the heart to pump at its normal range, it will increase because of the same hormones. They have influenced the normal functioning of the heart. As a result, there will be increase in blood pressure because the heart now will start pumping faster so that to supply these organs with enough blood and oxygen. So this one also affect the heart rate. So we have autonomic nervous system and the secreting chemicals. Secreting chemicals, they are talking about the hormones. The hormones, these are chemicals also. Chemical messengers produced by the glands. These are hormones. So once these hormones produce like the noradrenaline and the adrenaline, they influence the normal pumping action of the heart, which makes the heart to increase when it's pumping. Other hormones including thyroxine increase heart rate by their metabolic effect. Some drugs, dissolved gases, and electrolytes in the blood may either increase or decrease the heart rate. So for example, there are some drugs. When you take a drug and we say for the drug to show its effect, it has to be absorbed. When it is absorbed means it is in the bloodstream. There must be metabolic reaction or activities, then excreted. So some drugs you find that they will influence, they will make the heart, they will increase or decrease the heart rate, which can be also a factor. Then gases sometimes. Gases also sometimes can increase and decrease the heart rate, which was a factor also. Electrolytes, electrolytes in blood, maybe sometimes when they become more electrolytes, they can increase or they can decrease what? Heart rate. Position. When the person is upright, the heart rate is usually faster than when lying down. Why? So try to answer that. Why is when the person is upright, the heart rate is usually faster than when lying down? Okay, so when the person is upright, what will happen? Because you are saying when the person is upright, the heart rate is usually faster than when lying down. Yes, it's true. If you remember, there is that force of gravity. So when you stand, it means the heart will increase. The heart rate will increase so that there is that force of gravity to push blood down to the extremities, like the hands, the feet. And again, when the person is upright, what will happen to the vessels? The vessels will constrict so that to increase blood pressure, so that each organs or the body tissues receives oxygen and some other nutrients, also blood. So there is just that high force of gravity so that blood can reach the extremities like the hands and feet. That's how it is. So there must be force of gravity so that the blood reaches these parts, the brain, the feet, the hands, and some other parts of the body because of gravity. But when you lie down, there isn't that much of force gravity because the body is at rest again. The body is at rest. So it will just be easy for the heart to distribute blood. Then exercise. So exercise, active muscles need more blood than resting muscles, and this is achieved by an increased heart rate and selective vasodilatation. So remember, when you're doing exercise, it means these body tissues, the organs, they will need more oxygen. They will need more oxygen for energy to be generated. Now, what will happen? What will happen is the vessels will be dilated so that there is increased flow of blood to the areas. And when this blood is delivered to these parts, it means there will be now metabolic reaction to convert blood into energy. And that's why they are saying muscles, the active muscles, they need more oxygen or more blood than the resting muscles because they are generating energy, making you to do strenuous exercise because of there is that conversion of oxygen into energy through metabolic reaction. So exercise can influence or can be a factor that affect what? Heart rate. So when you're exercising, the heart rate will increase so that there is increased blood flow to these active muscles so that there is conversion of oxygen into energy through what? Metabolic reaction. So that's how it is. Emotional status during excitement, fear or anxiety, the heart rate is increased. Other effects mediated by the sympathetic nervous system may be present. So emotional status, whereby you just wake up with a mood, So that mood again will affect the heart rate. Maybe if you are just excited about something, you have even experienced that sometimes it can be decrease the heart rate or increase the heart rate. When you feel like something, there'll be secretion of adrenaline, and you know that what adrenaline do? It will increase the heart rate, because that adrenaline is a hormone that you influence now. It will make blood flow to increase, and once there is increase in blood flow, the vessels will dilate, and sometimes you just feel like start sweating, because now the vessels have dilated, making these fluids to start escaping the blood vessels to come out the body. So the others when they fear, they even start sweating. The vessels become visible to the skin because there is increased flow of blood, making these vessels now to dilate and become permeable, so that some fluids will start coming out. Person starts to sweat. Then gender, the heart rate is faster in women than it is in men. Yes, that's true. Babies and small children, the heart rate is more rapid than in older children and adults. Yes, you have seen, like for a unborn baby, the heart rate is 100 to 180. Then after that, when come to the external life, or the external environment, there will be 120 to 160 there, until the person grow up, and the heart rate will change according to the age. So according to the age, the heart rate will change. So that's how it is. Temperature, baroreceptor reflex. So that's how these factors affect the heart rate. So I've talked about the heart conduction system and factors that affect the heart rate. So today, if there are any questions, we discuss the questions tomorrow for those that you have questions. But today I just thought of recording the video or recording the audio, then I post into the group, so that at least those that you have time, they can go through with the way. Then after that, you make the questions, and these questions will be handled tomorrow, 16 hours. So I've just done this for time management, so that we can have time to ask questions, to answer the same questions as a group. So I've done this so that to at least give time to others who are reading and who are studying. Thank you very much.